Good afternoon, everyone. Welcome once again, and thank you for joining. Today, I'll be shedding some light on the effects of sunlight exposure during pregnancy, particularly in the north, on the health of the offspring. And just as a disclaimer, I apologize in advance for any of the unintended and intended puns throughout this presentation. So apart from that, I have no disclosures to declare. Vitamin D deficiency in pregnant mothers is increasingly prevalent in the north, particularly among our native populations. In fact, rates of up to 70% are reported in Inuit and other indigenous groups, particularly among mothers, where there is a low availability of vitamin D in diet, a lack of access to supplements, and of course, higher latitudes that prevent vitamin D synthesis. There's also an increasing prevalence of conditions such as rickets, which occurs due to vitamin D deficiency in Inuit children. Now, it is widely recognized that UV rays in sunlight can activate the vitamin D synthesis pathway, and that it can also have adverse carcinogenic effects if prolonged. However, there has yet to be any international or national guidelines on how much sunlight exposure is therapeutic, and if at all, if it is possible for sunlight exposure to replace the need for dietary or supplementary vitamin D. This is predominantly because the role of sunlight during pregnancy on the fetus is poorly understood, and quite ironically, a body of knowledge that still remains in the dark. So we hypothesized that sunlight exposure played a significant role in the fetal and embryonic development, affecting neonatal and long-term health outcomes. So the objective of this scoping review was to first examine the current evidence on how sunlight exposure during pregnancy influenced outcomes at birth and in the long term, and secondly, to contrive public health policy recommendations using a qualitative or narrative synthesis that also considered the epidemiology. So to accomplish these objectives, we followed the PRISMA guideline for scoping reviews to conduct a scoping review, utilizing Medline, Embase, and Google Scholar databases. So in our study, our inclusion criteria included primary research articles, case studies, systematic reviews, and meta-analyses, whereas our exclusion criteria were research with maternal health as its primary outcome, animal studies, and in vitro studies. So in brief, we screened over 3,000 titles, and after removing duplicates and screening the full text for eligibility, 14 studies were obtained. All 14 studies examined associations with a total of 5 retrospective, 4 longitudinal, 3 cross-sectional, and 2 prospective studies. Of the 14, there were 5 Australian and New Zealand, 4 European, 3 North American, 1 Asian, and 1 African study. In addition, 8 of them were related to immediate outcomes at birth, and 6 of them were related to long-term outcomes. Now, the results are promising, but nonetheless, the evidence is still in its embryonic stages. 5 out of 8 studies demonstrated an association between sunlight exposure and reduced adverse birth outcomes, including low birth weight, small size for gestational age, and preterm birth. On the other hand, 2 out of 8 studies showed no association, and 1 showed a negative association with these outcomes. Now, in terms of long-term chronic outcomes in childhood, the evidence was scarce, and it's still in its early stages, but sunlight exposure was demonstrated to be associated with skeletal growth and development, and reduced incidence of multiple sclerosis, asthma, and pneumonia. So this was a consideration that we had to take into account when we were considering the Inuit population. Now, a recurring concept in these studies was the timing of sunlight exposure, whether this be seasonal, geographical, or physiological exposure differences during a specific gestational phase. So results of these studies suggested that a lack of exposure during these critical trimesters had a greater risk for diseases associated with developmental programming during its respective stages. For instance, it is well established that the majority of the nervous system develops in the first trimester. And in one study, offsprings whose mother's first trimester overlapped with the winter months were shown to be at a higher risk of developing nervous system related conditions like multiple sclerosis in childhood. Incidentally, a similar association was noted with lower exposures to sunlight in the second trimester, which is implicated in lung development, and the risk of asthma in childhood in another American study. So in light of this, health policymakers around the world should consider exposure therapies that target these trimesters. Now, many of these studies also suggested alternative mechanisms of action for sunlight, which can occur independently or in combination with the vitamin D synthesis pathway. For example, in the sunlight serotonin pathway, it was proposed exposure to sunlight can affect the amounts of serotonin, which is a neurotransmitter implicated in regulating mood and low levels, which are also associated with seasonal affective disorder, which can then affect the mother's psychological well-being and perhaps indirectly affect the developing embryo or fetus. And another major consideration for us was epidemiology. So with only one study from the northern subcontinent of North America, it is difficult to validate outcomes in these regions. So differences in geography can contribute to differences in exposure with regions, particularly regions like Iqaluit up north, getting less than half an hour of daylight in the winter, and compared to places like Ivory Coast and regions around Ghana, where you can receive up to 13 hours of sunlight in the summer. There are also racial and genetic differences. Now, for example, non-Hispanic Black mothers have been shown to have lower adverse birth outcomes when compared to their non-Hispanic Caucasian counterparts. This may be an important consideration when we consider the indigenous groups, such as the Inuit, with darker skin tones and varying levels of pigments, such as melanin in their skin. Finally, behavioral and socioeconomic factors, such as access to sunscreen, type of home or habitat, and the kinds of clothing one must wear, can also influence the level of exposure that we're seeing. Now, in light of this, recommendations must target these genetic, environmental, and behavioral factors. In the North, we are challenged by our environment and overall lack of exposure to sunlight in the winter months. And as a result, there should be regional level, province or state level, and national or international scale policies that are formulated by consulting an interdisciplinary team of experts who can consider these factors. So just to give a few examples, atmospheric science experts, healthcare professionals, medical scientists, public health officials, and other policymakers are all individuals and stakeholders that we should be consulting. Now, to summarize, on the bright side, our results suggest sunlight exposure may indeed be implicated in proper development during pregnancy and impact both the acute and long-term development of the offspring. And ultimately, as a result, policies can focus on exposure therapies focused on trimester targeting, the mechanisms of action, and epidemiological factors. However, it is significant to realize that we have only reviewed the associations and that we still require further studies to shed more light on these effects in vitamin D deficient regions, particularly in the north and low sunshine environments, where research is still scarce. Thank you again for listening. This research would not have been possible without the support of our funding agencies and collaborators. I will now open the floor for any questions.